Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hello and welcome back to Headed to Healthier. I'm your host, Dr. Brittany Anderson, and in this episode, we are talking all about making the most of your doctor's appointments. Think about it. How many times have you left a doctor's appointment feeling like you forgot to ask something really important or feeling like you have no idea what the plan is, even though you sat through the whole appointment? Well, today we're going to discuss some strategies to make sure this never happens again. This episode is all about how to prepare for a doctor's appointment to make it as productive as possible and also as stress-free as possible. Whether you're seeing your primary care doc or a specialist, these tips that we'll go over today should help. I truly believe that having efficient appointments leads to better health outcomes. When you know why you're there and you make sure you get out of the appointment what you need, you will do better overall. So we're going to break this talk down into 3 parts today. We're going to talk about the pre-appointment preparation, we're going to talk about what you need to do on the day of the appointment, and we're going to talk about some post-appointment follow-up. All right, so let's dig into it. For pre-appointment preparation, so the first thing I'd say is make sure you're being really strategic in scheduling the appointment. If it is a chronic visit or something that is non-urgent, like an annual checkup, or you need medicines refilled, or you're following up on your hypertension or diabetes, don't wait until the last minute to make that appointment. Don't wait until you've almost run out of meds and you're calling last minute to get an appointment and you're going to have to take off of work and be possibly late getting there or stressing the clinic to get you squeezed in on the schedule. You want to really make sure you call in advance, especially for those types of concerns. That also gives you time to get all your thoughts together before the visit. Now, when you do call to make that appointment, be prepared to tell them why you're coming. My staff always ask, what do you want to see Dr. Anderson for this day? Or, what are you coming in for? The doctor usually wants to know, but more than that, it'll also sometimes affect the time that they put you on the schedule and how long of an appointment you get. So if you've got, 5 different things that you want to talk about, well, you may not get put in a 10-minute slot. You may get a 15 or 20-minute time slot instead, and that's important. And so you don't have to tell the medical receptionist all of your business when you're calling to schedule that appointment, but make sure you give them enough that they can get you an appropriate appointment time. Now, once you get that appointment, it's important that you confirm it. Most offices will either send a text message or will call you on the day before. If you have an option, make sure you confirm that appointment so that they know that you're coming. Some offices, I know from experience, if you don't confirm their appointment, they will take you off the schedule. And the worst thing you want to do is have made all these preparations and you've gotten yourself all psyched out for this visit, but you didn't confirm it and you get there and you no longer have an appointment. Now, I understand, like everyone else, that life happens. If it gets to where you have to cancel an appointment, make sure you do it in ample time so that you call the office, give them enough lead time that they can perhaps put someone else in that appointment slot. And if you have to cancel your appointment, make sure that you reschedule as soon as possible. The last thing that I want to talk about when we're getting ready for a visit or prior to the visit relating to scheduling is the financial prep. So making sure that you've got your insurance card handy. Most offices will require this to be on file. And also make sure you know your copay and have it ready. There's some systems that allow you to pay your copay in advance, but for most offices, you do that at the door. Let me tell you, there is nothing worse than getting to an appointment, having done all this prep before the appointment, but not having your wallet or not having any means to be able to make your copay and then being told that you have to reschedule that appointment. So make sure you do those things before your appointment. Now, when we get to the day of the appointment, this is where the action happens. First, you want to make sure you're on time. And even better than being on time is being a few minutes early. This allows you to get checked in, and it helps with minimizing some of the stress and feeling really frazzled before you get to that appointment. The last thing you want is to be running in the door, you get checked in, the minute you get your seat in a chair, the nurse is calling you back to get your vital signs, all of this because you were a little bit late. The last thing you want is to be in a rush when your vital signs are taken. If that's the case, sometimes it can make your heart rate be a little bit higher because you're feeling rushed. It can also lead to a higher blood pressure. And so giving yourself enough time to get to that appointment on time is really important. The last thing you want is to be started on a new medicine because your blood pressure is high or because your heart rate is really high, when really it's just because you've been fighting traffic or left work a little bit late and got to the appointment late. Also, make sure that you bring your medicines to the appointment. You can bring a list of medicines. Even better though, bring the actual bottles. This ensures accuracy and helps to make sure that we avoid medicine interaction. So you're not getting something new prescribed that actually interacts with something else that you have. If you've had lab work from an outside lab, make sure that you bring that with you too. There are few things worse than a patient saying, you know what, I had labs done somewhere else and I believe there was something not normal about them and they told me to come back to you for you to see what's going on, but I don't know where those labs are. I've got a copy of it somewhere. It may be in my car. Those are things that we want to see. I want you to bring in any lab work, any documentation that you have from outside visit. The other really important things to think about on the day of the visit is making sure you are prepared. I love when my patients have thought about the visit before they get to the visit, and I encourage my patients, just like I encourage you, to write down a list. If there are some things that you have questions about that you really want to make sure you bring up at that appointment, write them down. Now, don't get out of control with that list and have 15 or 20 things on there because you may not get to all of them in the appointment, but do write down the things that between the last appointment and the next appointment that you think about. It could be that you jot them down on your phone, you can put it on a notepad that's in your purse, and when the nurse triages you for the visit, like when they're getting your vital signs, you can give it to her or him then, and you can also have it handy when the doc comes in the room. Now, you may, before you go into this visit, want to think about, especially if that's a long list, maybe pick out the top 2 or 3 things that you have to discuss before you leave the room that day. I can't tell you how often it happens that I have a whole visit with the patient, I'm about to leave the room, and I say, is there anything else that you want to talk about today? And they say, oh, there was something else. I just can't remember what it is, Dr. Anderson. And sometimes I think that my patients think I'm going to just stand there for minutes on end while they try to think of what it is. Now, sometimes I usually do make a little small talk or I'll start jotting in their chart or something to give them a little bit of time. But after a couple minutes, I'm likely leaving that room. And I can pretty much tell you that once I've left the room, you may have a hard time getting me back in there because I have other patients who are waiting. And so I usually will say, all right, if you can't think of what it is in the next few minutes or before you leave out of here, give us a call back. Or, if it's not anything urgent, which usually it's not if they can't think of it on the spot, then I'll say, next time you come in, we'll be sure to talk about that thing first. And so you can avoid that situation altogether by jotting those things down in advance. The other things I'd ask you to do to make this visit most efficient is to be an active participant. So don't be afraid to speak up. The doctor-patient relationship is really important. I, as the doctor, want to know that my patient, thinks enough of me that if they have a question, they'll ask me that question in the room. And I certainly, as the doctor, think enough of my patient that I want them to ask those questions. The last thing I want is for you to leave the appointment and you either feel like you didn't get something out that you needed to, or to feel like you were talked down to or made to, not feel like you could ask questions while you were in the room. And to that same point, before I leave a room with my patients, usually I'll kind of summarize what we talked about, especially if it's a really detailed plan. So in our office, our patients actually get little printed summaries, but before we started doing this, I'd recap the visit. I'd say, all right, so this is what we decided we're going to do about this. And sometimes I'll have my patients talk back to me and I'll say, so now you tell me what we said we're going to do about your blood pressure. Or do you remember what I said we're going to do about that rash? And I think that those things are really important, that the patient is able to leave the room knowing I know what the next step is. And then we get into the post-appointment follow-up. So the most important thing, like we just talked about, is making sure you understand the plan, that you know what the treatment plan is, you know if you're supposed to be going to the pharmacy to pick up medicines, you know how to use those medicines, and you know any important follow-up instructions. If you are told when you leave the room, either by the doctor or by the nurse, that they're going to call you back in a few days with your lab results or to get a referral done or test results, if you haven't heard back in a few days, you should give the office a call back. We in our office try really hard to make sure that we always return calls, even if their labs or tests are normal, just so patients get in the habit of hearing back from us. Now, you certainly don't want to leave one day and call back the next day and say, hey, I was there yesterday, nobody's called me with my results yet. They may truly not have them yet. But if an appropriate or an inappropriate amount of time goes by, I would encourage you to call and say, hey, I was there last week and had some labs done. I may have missed a call back with the results. Is there someone who can give me the results of my labs? Or it may be that you are waiting on a referral and it's been a week or 2 weeks and you haven't heard anything back. Well, you first want to make sure they actually put the referral in. It may be that your primary office didn't put them in, or it may be that the doctor that you're going to, that they referred you to, just hasn't called back. And sometimes it's important to, circle back and make sure that you've got those things taken care of. The other thing I'd ask you to do is document your health. And so keeping these things on file. And so just like I believe it's important to jot down notes before you go to an appointment where you jot those questions down, you can also jot down the responses so you have that. And if you were to keep all these things together in a spiral notebook, or even if it was on an app or on something on your phone, then you can look back at that thing later and be able to say, oh, Dr. So-and-so told me this at the last appointment. That also is really important when you're going to specialists and you then are going back to see your primary care provider and they may not have notes from the last appointment. And so you can tell them what the specialist said or what they changed if you've got it there and you've jotted it down. All right, so let's recap a little bit. In summary, ways that I believe you can make your doctor's appointments more efficient is to schedule in advance, confirm if you're going to be there, cancel and reschedule if you can't make it. Make sure you give yourself enough time to get to the appointment so that you're not rushed or frazzled. Make sure that you have your questions or concerns handy and that you bring your medicines with you. And make sure that you know the plan before the doctor leaves the room. And post-appointment, making sure that you follow up to make sure that any after-visit care that you need is taken care of. I cannot stress enough the importance of being an active participant in your healthcare. As a physician, this is important to me, but as a patient, it's also important to you. So I really encourage you to implement these tips that we went over today at your next appointment. Thank you so much for tuning in to today's podcast. I hope that you learned something about how you can make your appointments more efficient. Be sure to subscribe, share, leave a review if you haven't done so already. Please also join the Facebook group. The link to join is in the show notes below. I hope you have a great rest of your day, and I'm so happy to be on this path with you as you are headed to healthier. Thanks. Bye. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.